A defibrillator is a piece of emergency medical equipment that delivers a controlled electric shock to a patient that's in cardiac arrest. It's important because the window of opportunity to shock this patient is usually very small. Defibrillator needs to be on scene as quickly as possible to achieve maximum effect. Reassuringly, a defibrillator will only shock a casualty that actually requires defibrillation. Once you've ascertained the person isn't breathing normally and a defibrillator is made available, if you're on your own, you need to apply the defibrillator straight away. If you're working with somebody else who is trained, CPR should also be carried out at the same time as the defibrillator has been applied. Now, remembering from your course, the pad placement is extremely important. We need to put contact on bare skin. The first pad is going to go up just under your right collarbone, and the second pad is going to go under the lower left armpit. It's really important they're placed in this manner so maximum shock efficiency is achieved. When we're placing the pads, we're also looking out for any patches, any heavy set of perspiration, or maybe the casualty might need to be shaved slightly to achieve maximum contact. If it's a female and they're wearing a bra, ideally the centre peg of the bra should be cut and the cups removed to prevent metal underwire interfering with the electric current. All through the process, follow the voice prompts on the defibrillator. Whilst the defibrillator is analysing, it is imperative nobody touches the patient.
Do not touch patient. Analysing rhythm.
This is to decide what's actually happening with the patient and to minimise other people's interference with their own heart arrhythmia. At the point the defibrillator advises a shock, from a safety point of view, we need to check the top, the middle and the bottom of the casualty to ensure they're not touching any metal surfaces and that all rescuers are safely away from the casualty once the shock is discharged. Whoever's going to press the red button that's flashing needs to carry out this check prior to pressing the button. Once the shock is delivered and the casualty comes to rest, it's important that CPR commences at the earliest opportunity. So we're going to continue CPR now for 2 minutes until the defibrillator analyses the patient again. It's important to understand that after every analyse, the defibrillator may or may not advise a shock. You'll recall from your course that we went through shockable and non-shockable rhythms. This is important for us to understand exactly the capabilities of our defibrillator. Non-shockable rhythms will include normal sinus rhythm, like you're in now, or pulseless electrical activity. This is where the heart beats essentially normally, but doesn't have much blood or any blood transiting through the heart, hence it's pulseless. The final non-shockable rhythm is known as asystole or asystole. This is where the heart has no electrical activity at all. Shockable rhythms will include ventricular fibrillation. This is the most common form of shockable rhythm, or pulseless ventricular tachycardia, where the heart is beating so fast that there is minimal blood actually transiting through the heart due to chamber fill.